shock. Compensated shock. Change in LOC, increased pulse and respirations, cool, pale skin, normal to slightly increased BP increase due to initial vasoconstriction. Uncompensated shock. Decrease in LOC, unconscious, decrease HR, decreased respirations, cyanosis, decreased perfusion to tissues, lactic acid buildup, hypotension. Neurogenic shock. Warm, dry, flushed skin and capillary refill normal, neurologic deficit, change in respiratory pattern, hypothermia, hypotension, HR normal or bradycardia, cervical vertebrae most commonly fractured, phrenic nerve controls chest wall. Anaphylactic shock. Itching, flushing, hives, swelling of eyelids, lips and tongue, tightness in chest, severe dyspnea, abdominal cramps, nausea and vomiting, diarrhea, tachycardia, hypotension. Anaphylactic shock. Anaphylactic shock. Psychogenic shock. Fainting with no sign of serious injury or illness, SOB, anxious, increased HR, respirations, BP, respiratory alkalosis due to hyperventilation, normal pulse oximetry. Septic shock. Elevated temp initially, decreased temp late sign, petechiae, decreased LOC, creeping mottling, tachycardia and hypotensive. Treatment, fluids initially then consider dopamine. Elderly, UTI may be source due to urinary catheter. Cardiogenic shock. Dyspnea, rales, tachycardia, decreased BP, increased respirations, diaphoresis, arrhythmias, increased blood volume in lungs and liver due to pump failure. Treatment consider dopamine to increase BP 2 to 20 mcg/kg/min. Hypovolemic shock. Increased HR and respirations, decreased BP, cyanosis, diaphoresis, internal or external bleeding, LOC changes, anxious appearance, hypoxia. Neurological emergencies and aneurysms. Neurological emergencies and aneurysms. Cerebral artery aneurysm. Severe headache, blurred vision, altered LOC, S/SX-CP. Thoracic aortic aneurysm. Sudden onset, pain, ripping or tearing sensation. Pain may radiate to the neck, back, shoulders, or abdomen, stridor or hoarseness, dyspnea, dysphagia, S/SX of hypovolemic shock after rupture. Abdominal aortic aneurysm. Lower abdominal pain on the left side. Pain may be constant or intermittent, palpable abdominal pulse, lower back or flank pain, unequal or absent distal pulses. Transient ischemic attack. Same as EVA but not permanent, resolves between 24 to 48 hours. Cerebrovascular accident. Headache, change in LOC, blurred vision, unequal pupils, hemiplegia. Common causes are hypertension and arteriosclerosis. Cerebrovascular accident. Treatment. No treatment in pre-hospital setting. Rush patient to stroke center for heparin therapy. More time goes by the worse the outcome. Hemorrhagic stroke, quick. Ischemic stroke, slow. Hypertensive crisis. Headache, dizziness, restless, blurred vision, nosebleed, vomiting, seizure, stupor, coma. Cardiac emergencies. Cardiac emergencies. Cardiovascular pharmacology. Drugs ending in ZEMCA, plus channel blockers, drugs ending in PRIL-ACE inhibitor. Cardiovascular pharmacology. ABCD1 heart 2 lungs A to C B to D alpha 1, vasoconstriction of heart alpha 2, vasoconstriction of lungs B to A1, vasodilation of heart B to A2, vasodilation of lungs. Acute myocardial infarction. Skin cool, pale, sweaty, sob, anxious, feeling of impending doom, pain that radiates to arm, shoulder, neck, jaw, or back, N/V, begins at rest, denial, may have normal VS in the beginning with NO chest pain, not relieved by nitroglycerin. Angina. Induced by exercise, emotion, eating, relieved by nitroglycerin and rest, main symptom of CD, lasts 3 to 5 months typically. CHF/left-sided heart failure. Dyspnea, rales, tachycardia, chronic atrial arrhythmias, pink, frothy sputum, orthopnea, increased BP. CHF/left-sided heart failure. CHF treatment in pre-hospital setting. O2, nitroglycerin, morphine vasodilated. Decreased workload of fatigued heart muscle allows heart to pump more effectively. Right-sided heart failure. Peripheral edema, JVD, ascites, patient may see a right pain D/T enlarged liver. Trauma emergencies. Chest trauma, cardiac and pulmonary emergencies. Trauma emergencies. Chest trauma, cardiac and pulmonary emergencies. Pericardial tamponade. Shock, mechanism of injury, dyspnea, weak, rapid pulse, equal breath sounds, Beck's triad. O muffled heart sounds. OJVDO narrowing pulse pressure. Flail chest. Hemothorax. VS may present like shock, NOJVD, hyporesonance chest sounds. Myocardial contusion. Sternal bruising, chest pain, arrhythmias, sob, dyspnea, usually seen in MVC blunt force trauma. Chest into steering wheel. Myocardial contusion. Treatment. Administer O2, consider needle decompression. W/tracheal deviation, absent breath sounds, JVD. Pulmonary contusion. Often asymptomatic initially, monitor for increased respiratory distress, monitor for signs and symptoms of hypoxia, contusions and abrasions, mechanism of injury, respiratory distress worsens before it improves. Pulmonary embolism. Sucking chest wound. Same as pneumothorax, open wound on the chest wall, may hear sucking sound. W/part respirations, treatment. 3-sided dressing. Allow air to escape or attention pneumo will develop. Pneumothorax, spontaneous or traumatic. Spontaneous usually occur in tall, thin part with coughing episode, sudden onset of sharp chest pain, shortness of breath, decreased or absent breath sounds on affected side, occurs after sneezing, coughing or straining, history of previous pneumothorax, tall, thin male susceptible. Tension pneumothorax. Severe increasing dyspnea, weak, rapid pulse, decreasing BP, possible uneven movement of chest wall, JVD, cyanosis, decreased breath sounds on affected side/hyperresonance, tracheal deviation, displaced heart sounds. Traumatic asphyxia. Head, neck, and shoulders appear dark blue or purple, eyes may be bloodshot or bulging, chest wall appears deformed, severe respiratory distress, severe shock, many are CPR on scene. Closed head injury. Blunt trauma to the abdomen. Same as penetrating, liver, spleen, and pancreas are most commonly injured, shock, pain to affected area, contusions, abrasions. Injuries to the structures of the neck. Pain at the injury site, dyspnea, stridor, difficulty swallowing, difficulty speaking, swelling, bruising, hematoma, obvious spinal deformities, subcutaneous air, hemoptysis. Airway and respiratory emergencies. Airway and respiratory emergencies. Chronic bronchitis. History of smoking, persistent productive cough for 3 months and 2 consecutive V's, overweight, cyanotic, coarse raunchy and wheezes that clear with cough, normal or slightly increased respiratory rate, frequent respiratory infections, dyspnea. Chronic bronchitis. Treatment: albuterol X3 first, then albuterol/atrovent if no improvement, may use SQEP if Part W/no cardiac problems. Pulmonary emphysema. Dyspnea, pursed lip breathing, wheezing, barreled chest, thin, cannot complete sentences, D/T sob, HOMO2, tripod positioning, use of accessory muscles when breathing, clubbing of fingers. Asthma. Pneumonia. Green and yellow mucus, chills and shivering, weakness, productive cough, may show signs and symptoms of respiratory distress, tachypnea, rales or raunchy, chest pain made worse by coughing, fever, usually only affects one side. Pneumonia. Treatment: O2, fluid, may use albuterol for bronchodilator. Foreign body aspiration. Sudden onset of respiratory distress, W/no history of infection, dyspnea, stridor, localized wheezing, coughing. Hyperventilation. Carpal pedal spasms, good color, clear breath sounds, numbness and tingling of fingers and extremities, tachypnea. Acute respiratory failure. Cyanosis, decreased LOC, bradycardia, labored or poor respiratory effort. Peritonsillar abscess. Sore throat, fever, difficulty swallowing, leaning over to breath, drooling, neck swelling, foul-smelling breath. Medical emergencies, general. medical emergencies, general. Hypoglycemia. Sudden onset, dilated pupils, tachycardia, decreased LOC, diaphoretic, cool, clammy skin, headache, weakness, dizziness, tremors, history of diabetes. Hyperglycemia. Polyphagia, polyuria, polydipsia, blurred vision, weight loss, dry mouth, dry, itchy, warm skin, poor wound healing, chesmal respirations, fruity breath, gradual onset, give fluids, then insulin. Sickle cell crisis. Severe chest, abdomen, muscular, or bone pain, fatigue, tachycardia, priapism, fever, give fluid, pain medications, increased cramping, SOB getting worse, increased O2 can cause more cells to sickle. HHNS. Mimics DKA without increased ketones, no chesmal respirations or fruity breath, no nausea or vomiting. Treatment goals, management, and complications are similar to DKA. Internal organs, solid and hollow. Internal organs, solid and hollow. Acute renal failure. Decreased urine output, hypertension, altered LOC, nausea and vomiting, diarrhea, dialysis/electrolyte imbalances. Chronic renal failure. Decreased urine, hypertension, fatigue, weakness, congestive heart failure, acidosis, uremia, central nervous system changes, seizure, coma, edema, death. Kidney stone. Severe flank pain, radiation of pain to groin, fluid resuscitation and morphine. Gastrointestinal emergencies. Distension of the abdomen, tender rigid abdomen, guarding, positive tilt test, increasing pulse, shallow increased respirations. Liver injury. Stomach injury. Tenderness, guarding, rigidity, distension. Spleen injury. Fracture of the 8th, 9th, or 10th ribs on the left side, unexplained tachycardia/hypotension trauma, abdominal tenderness/guarding, pain radiating to the left shoulder. Gallbladder injury. Intermittent, cramping pain, fullness in ruck after meals, pain or discomfort, NNV. Pancreas injury. More susceptible in alcoholics, acute onset of severe epigastric pain that may radiate to neck, attacks occur a few hours after a large meal, heavy alcohol intake, spicy foods, NNV, abdominal tenderness, rigidity, or distension. Gastric ulcers. Bladder. Blood in the urine, urinary frequency and burning, painful urination. Kidney injury. Rib fractures involving the 10th, 11th, or 12th ribs, back or flank pain, bruising/swelling over the back/flank areas, S&S shock. Pediatric emergencies, respiratory. Pediatric emergencies, respiratory. Shock. changes in LOC, tachycardia, pale, cool, mottled skin especially in extremities, increase capillary refill, sunken fontanelle, tachypnea, treat with 10 to 20 milliliters per kilogram NS, reassess frequently. Pediatric with asthma or bronchitis. Dyspnea, tachypnea, expiratory grunting and or prolonged expiration, wheezing, retractions, nasal flaring, tachycardia, albuterol/atropine treatments, steroids, fluid boluses. Croup. Gradual onset, 6 months 4 years of age, seal bark, high-pitched, hoarseness, stridor, low-grade temperature, tachypnea, racemic epinephrine, cool mist, keep child calm. Meningitis. Labor and delivery. Labor and delivery. Normal L&D impending childbirth. Early labor o vaginal discharge mucus plug or bloody show o back pain, mild to moderate contractions, active labor o regular contractions lasting 1 minute, getting closer together o pain if contractions increase, may be felt in back and abdomen o cervix dilates o crowning. Cord protruding from vagina, goal is to relieve pressure off the cord. Cord protruding from vagina, goal is to relieve pressure off the cord. Breech presentation. History of previous breech delivery, fetal heart tones heard best in upper abdomen, feet, buttocks, arms, crown before head. Meconium-stained amniotic fluid. Usually past due date, greenish to brown color to amniotic fluid, suction ASAP mouth then nose. Abruptia placenta. Minimal vaginal bleeding, rigid abdomen, severe abdominal cramping, signs and symptoms of shock, pain does not cease. Placenta previa. Painless, heavy bleeding, bright red blood, occurs without warning. Female reproductive organs. Female reproductive organs. Pelvic inflammatory disease, gonorrhea and chlamydia. Low abdominal pain with walking or movement, vaginal discharge, fever, N/V, generalized weakness. Ectopic pregnancy. Presence of pregnancy symptoms, history of PID, tubal ligation, fertility drugs, abnormal menstrual cycles, spotting may or may not occur, shoulder pain, abdominal tenderness/rigidity, positive tilt test, shock, guarding. Environmental emergencies. Environmental emergencies. Heat exhaustion. Patient will be awake or slightly decreased LOC, lightheadedness, headache, or irritable, normal or decreased blood pressure, positive tilt test, increased respirations, tachycardia, temperature normal or slightly increased, skin pale with excessive sweating, NV, heat cramps. Heat stroke. Early, dizziness, headache followed by psychotic behavior, seizures, and coma, blood pressure may be elevated, tachycardia with bounding pulse, increased respirations, temperature is extremely elevated, skin is usually hot, red, dry. Frostbite, local. Systemic hypothermia. Early O part is conscious but slow to respond O shivering, increased metabolic rate O impaired judgment O poor coordination O vasoconstriction cold, pale skin. Systemic hypothermia.